This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
So I was going to talk briefly a little bit about acute allergic reactions after vaccinations, something that you've clearly heard about and that has raised the concern for the community and has led to some vaccine hesitancy. So I think it'd be important to know some background in terms of the incidence, and then also talk a little bit about ED management. So we had a case of a patient that came in, has a history of environmental allergens, allergic reactions, and received the first dose of the Moderna vaccine and soon after developed throat discomfort. In terms of management, the management is generally the same as another acute allergic reaction, but the reason why I was talking about this as a medical minute is one, to help inform sort of healthcare providers so that we can counsel our community on the low incidence of the illness and complications, and then also to talk a little bit about what we advise our patients who have received that vaccine about additional doses of vaccine or alternatives. So the incidence is reported to be about 2.5 to 10 per million, and it typically occurs in people who have allergic reactions to environmental allergens. So, you know, at the high end, maybe 1 in 100,000. That may change as more data arises, but still considered extremely rare. Typically occurs with the mRNA vaccines and not the adenovirus vaccines. So right now, in terms of approved vaccines, you know, Moderna and Pfizer is based on that mRNA technology, and the delivery vehicle for that is the lipid nanoparticles, which help deliver the mRNA, and apparently that's the substrate for, or the trigger. So it ends up that you should not get the second dose of the vaccine if you had that first one, and you generally are recommended to get the adenovirus, so that for our patient, we counseled her, especially since she lives with an immunocompromised spouse, to get the J&J vaccine when it becomes available to her. And you know, there's no real strong evidence-based guidelines on timing, but generally it would be accepted to wait that 1 month and treat it like, you know, the second dose of her vaccine series. So hopefully that gives you a bit of a perspective on, you know, the actual low incidence and allows us to counsel our community on the safety of these vaccinations, and it gives you a sense of what you could expect when we're managing an allergic reaction to those mRNA vaccines and how we counsel our patients on that second vaccine dose. Okay? Does that all make sense? All right.
The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA, PRA, Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.